Hello. Today I will be talking about genital herpes and the various treatments and measures that can help to keep it under control. Genital herpes is a sexually transmitted infection or STI, and it is caused by Herpes Simplex Virus Type 2 or HSV Type 2. The infection can be transmitted through vaginal, anal, or oral sex. Herpes simplex virus stays in the body for life once the infection has occurred. Genital herpes is very contagious and can easily be passed on to others. The infection can happen from when the symptoms first occur to when the sores have completely gone away. It is possible to pass on the virus even if there are no active symptoms. Genital herpes can be caught through skin-to-skin contact with an infected area such as the vagina, the penis and anal region, and with oral sex. This can occur in the absence of any visible sores or blisters. Genital herpes can also be caught if a cold sore or oral herpes touches genital area, with infection on fingers that touch genital area, and by sharing sex toys with someone who has herpes. The infection does not survive outside the body, so it is not possible to get genital herpes from sharing cutlery, cups, or other similar objects. Genital herpes also cannot spread from toilet seats, bedding, sharing towels or soaps, or from swimming pools. Genital herpes sores usually look like a cluster of blisters filled with fluid. These can be painful or itchy. Genital herpes sores can be different sizes and can occur in various places in the genital and anal region, and on buttocks and thighs. Sometimes, these sores can break leading to bleeding and discharge. The sores can resolve on their own without treatment, and they could come back again as an outbreak. Recurrent outbreaks usually produce milder symptoms than the first episode. The frequency of outbreaks may become less and less over time and less severe. It is possible that some people may never get any outbreaks. The common symptoms of genital herpes are blisters that can be open sores, tingling, burning or itching in the affected areas, pain on urination, and unusual discharge. If there are sores or symptoms suggestive of genital herpes, it is advisable to see a doctor or go to a sexual health clinic for further assessment and testing. Genital herpes can be treated with an antiviral medication called Valtrex or valacyclovir. The treatment with antiviral medication could help shorten an outbreak by a few days if is taken as soon as the symptoms start. If there have been more than 6 outbreaks in a year, taking antiviral medication for 6 to 12 months can be beneficial. There are several measures that can help to reduce the pain or discomfort associated with genital herpes. It is recommended to keep the affected area clean using plain or salt water to prevent further infection. An ice pack can help with the pain or irritation. Ice should not directly be put on the skin. Vaseline or 5% lidocaine numbing cream applied to the area could help with pain as well. Pouring water over the genitals during urination can help ease the pain. It is best to avoid tight clothing and underwear that might irritate the sores. It is advised to avoid vaginal, anal or oral sex until all the sores have gone away. It is also advised to avoid any possible triggers such as sunbathing or sunbeds, irritants or friction in genital area, smoking, and alcohol. The other possible triggers of genital herpes are monthly cycle, surgery in genital region, stress, low immunity, and other infections. Genital herpes infection before a pregnancy should not cause any major problems during the progression of the pregnancy and the labor. If there are symptoms of genital herpes during a pregnancy, it is strongly advised to see a doctor in person as treatment with antiviral medication may be needed.